Over the last few years, we've had substantial increase in prescription drug prices and a lot of public outrage about those price increases. And there have been a lot of proposals as to how to regulate those drug price increases. Let's remember that drug companies are given a monopoly for new brand name drugs. The government issues them patent rights, and they also are given FDA marketing exclusivity. Now, basic economics says that when a company is given a monopoly over a product, they will substantially raise the prices. And that's what we're seeing in our prescription drug marketplace. When drug companies are given a monopoly, they raise the prices. Well, how can we combat that? Fundamentally, it requires some kind of government regulation. And there are various different proposals as to how to regulate the drug industry and drug prices. One is, let's have Medicare, the biggest purchaser of drugs, go in and negotiate prices. You've heard President Trump make that suggestion. Another way is to allow imports and cheaper drugs from other countries like Canada come into the country. A third way is what many countries overseas do. Switzerland, for example, imposes a maximal price for drugs. A fourth proposal is what's done in Australia and Britain, and that is to look at the cost effectiveness of drugs and to rate and limit the prices that can be charged based upon how effective a drug is. I think in the long run, the best approach is what's called value-based pricing. That is, we tie the price of a drug to its health benefits. Drugs which are really beneficial, that is, they cure someone of a deadly disease or they make a deadly disease more livable, they should have a high price. Drugs that aren't so important, aren't so effective, they have a much lower price. This value-based pricing, I think, seems intuitive to most Americans. We should pay more for things that are more beneficial to us. The political debate over drug pricing will go on for a few years. Americans are reluctant to have government regulation. But fundamentally, with drug companies having a government-given monopoly, they will raise prices, and the only way to control that increase in price is largely by government regulation. Whether it takes place through Medicare negotiation, re-importation of drugs, a maximal price on a drug, or some cost-effectiveness mechanism a la Britain or Australia, or value-based pricing, we're unsure how it's going to evolve. But my prediction is that in the next decade, we will end up with some government regulation over drug prices because the American people will demand it.